Professor De Raeve, welcome. Thank you for participating for this interview. We have 5 questions for you. The first one. You have recently met 55 nursing students in Luxembourg. In your dialogue with the students, did they refer to mental health, burnout, or stress at the workplace?
Thank you very much for this very interesting first question. Indeed, and their message was very clear. Despite their young age, they are all dealing with stresses and burnout already now at the workplace. And they are very much aware that as nurses, there is often no time to properly process or cope with emotional and physical demands of the job. A quote of one of the students perfectly summarizes this. She says, "Burnout often has little to do with motivation or dedication, and far more to do with a system that demands constant energy without providing enough opportunity to rebuild it."
Okay, very interesting. But did the Luxembourg focus group showed interest in the possibility of using AI-supported interventions and virtual reality to lower down their stress while doing their job?
Their views on this were quite interesting. On one hand, it is clear that most are already using tools, artificial intelligence tools, to support their daily nursing work. But on the other hand, it was also very clear that only a few of them had considered the possibility of using such tools to improve their mental health and resilience. Despite this, many students, nursing students in Luxembourg, seemed interested about the possibility to testing innovative interventions like deep relaxation with VR.
These are all new views, but very innovative. Further on, you met nursing leaders at the 30th Congress of the International Council of Nurses, ICN in Helsinki, which brought together 7,000 nurses from the globe. EFN interviewed several nursing leaders, asking them about their experience and perspective on the use of innovative digital, AI and non-digital based interventions to support the nurses' mental health. What were their key messages?
Indeed, it was interesting being in Helsinki and interviewing some nursing leaders from the globe. Some of these nursing leaders that we interviewed had first-hand experience in projects that aim to test the possibility of using digital artificial intelligence powered tools to provide mental health relief support for frontline nurses. Their message was also very clear. These tools can be very effective, and in certain cases, like the Health Village project and the Health Village platform developed in Finland, these are already being used across the country, across the entire Finland. On non-digital interventions, they emphasized the importance of debriefing sessions as nurses are dealing during their shifts with a lot of trauma, and they need to be able to receive support from their team members to cope with this stress.
Of course, this all sounds very normal to us, but it's such a huge task to tackle. With this frontline evidence, What is WHO Europe doing on mental health for nurses and doctors that could be helpful for Keep Caring?
Indeed, WHO Europe, with the European Commission funding this research, has conducted a first of its kind EU survey on mental health for doctors and nurses. Only for doctors and nurses. The report, based on more than 100,000 surveys collected, will be launched on the 10th of October, providing important insights on this huge challenge and what frontline healthcare professionals are doing to cope with stress and burnout. It is key to connect these results to the work being done in Keep Caring, as otherwise we keep on working in silos, leading to no frontline improvements, leading to non-frontline change.
My last question to you, Professor De Raeve. The European Parliament Employment and Committees are having a joint public hearing on the ENI report on the EU healthcare workforce, a key political moment for the recruitment and retention of nurses. How can Keep Caring developments, in your view, be linked to this ENI report?
Indeed. Yesterday, we had the first public hearing in the European Parliament, and mental health and burnout will be key important topics in the ENI report on the health workforce in the EU. But whatever the politicians will decide, EFN wants concrete, bold, and focused actions to tackle nurses dropping out of the nursing profession. We need first safe staffing levels that keep nurses in the profession. These safe staffing levels will benefit the reduction of stress and burnout. And innovative digital and non-digital interventions, like you are developing in Keep Caring, need to be used frontline, as they can really help improve the recruitment and the retention of nurses and doctors to the nursing and medical profession. This is something that the European Parliament, the European Commission and the Council, the Member States, need to take very seriously. And the findings and developments of Keep Caring could inspire politicians and policymakers, MEPs, to develop policies that are fit for purpose. This is key, as the EU has relevant competencies in relation to working conditions and occupational health and safety, both of which are directly connected to safe staffing levels and the focused Keep Caring outcomes deliverables, as they are all grounded in Article 153 of the Treaty of the Functioning of the European Union.
Thank you, Professor De Raeve, for this very interesting interview. It was inspiring and innovative and can mean so much for frontline nurses to take their healthcare seriously. Thank you so much.